Well, thank you very much, Chair Baldwin. Secretary Becerra, good to see you. I appreciate you joining us today. HHS really is on the front lines of some of the most challenging issues that our families are facing: opioids, mental health, childcare, so much more. It is crucial that we maintain strong investments in life-saving biomedical research, building a strong healthcare workforce and public health system, getting families affordable care close to home, and a lot more. Not to mention the constant attacks on reproductive care. Women in 21 states are now living under abortion bans, and Arizona is under a ban that dates back to before women even had the right to vote. Despite strong support for abortion access around the country, anti-abortion extremists are continuing to attack not only abortion care, but IVF and birth control. Everyone, I believe, deserves the freedom to control their own bodies, their own lives, and their own future, free from interference from politicians, which is why I strongly support President Biden's decision to once again remove Hyde from this year's budget. I look forward to continuing to work with you to protect reproductive health care every way we can in all 50 states. And I'm glad we have the opportunity today to talk about how we can provide the resources necessary to meet all the health care challenges before us and support families in my state and across the country. Programs like childcare and Development Block Grant and Head Start are a lifeline for working parents who need affordable, high-quality childcare and early learning opportunities for their kids. They're an investment not just for our families, but in our workforce and in our economy. So I'm really glad that Senator Baldwin and I were able to send an increase of $1 billion to the President's desk to invest in childcare and early learning for FY24. Since 2015, I and many others have increased funding for these programs by more than 250%. But it is, as you know, a drop in the bucket when looking at the child care crisis that exists in this country. We need to protect and strengthen the investments we've made to make sure families can find and afford child care however possible. That means more annual funding, extending stabilization dollars, and hopefully passing my Child Care for Working Families Act. Can you tell us today about the current state of the child care sector and why investments in programs like CDBG are critical now more than ever?
Senator, thank you. And again, thank you for championing child care writ large and your success in getting additional funds for so many families desperately in need. Today, getting child care is like having your infant go to college. The cost of child care is essentially tuition in a major university. It makes it very difficult for parents, especially parents who have more than one child, to really sustain that. We also know that the quality of care can sometimes be questionable because the pay for some of these workers is so low. You can sometimes make more money flipping burgers than caring for children. We need to change that as well. The President's budget, thanks to the investments that many of you have made possible, will continue to move an effort. The President's proposal would make it possible for some families to qualify to have child care for $10 a day, which would ultimately save them each, those families, about $7,200 in a year in the cost of their child care when you total it up. That would be a proposal that would help so many of the families, some 16 million families would qualify for that support. And so it's so important to move forward, as you said, to continue to make the investments in child care.
Thank you. I really appreciate that. We'll continue to focus on that. Mr. Secretary, this week is Black Maternal Health Week. It's an important time to talk about the devastating maternal mortality crisis here in the United States. The U.S. is now one of the most dangerous places in the world to give birth, and that really is astounding to me, despite most maternal deaths being preventable. It is clear our systems are failing mothers, especially Black, Hispanic, and Native mothers who experience the highest rate of maternal mortality. And extreme state abortion bans passed since the Dobbs decision have further eroded the access to maternal health because we don't have as many providers for maternal health care across our country. We were able to secure a $21 million increase for the Improving Maternal Health Initiative across HRSA, CDC, and NIH in our FY24 bill, and building on increases from 23, and I hope to continue that process in this progress in this budget. Can you talk to us about what HHS is doing now to address this issue and about the additional investments in maternal health that you're actually proposing for next year?
And again, because of the efforts of you and others, we've been able to continue to increase the funding of maternal health. This budget, 2025 budget by the president, provides close to $400 million for maternal mortality and morbidity to address that, because as you mentioned, in too many cases, a black woman is 2 or 3 times more likely to die at childbirth than a white woman. I think I misspoke and said $8 billion. It's actually $2 million in this federal budget by the president is dedicated to maternal health. We are now, as I mentioned earlier before you got here, Senator, making available care for a woman who qualifies for Medicaid and for her baby, rather than just for 60 days, she now qualifies for 365 days of care, and so does her baby. We're doing a lot. Doulas are being made available to families. We're trying to do what we can up front before the delivery, so the woman gets good care before delivery, gets good care during delivery, and good care after delivery.
Okay, very good. And finally, on youth homelessness prevention, I am laser focused on making sure the federal government is doing everything we can to support young people who are experiencing homelessness and doing more to prevent it. I was very proud to champion new funding in our 24 bill for a demonstration program that will provide grants to state, local, and tribal governments and local organizations to help prevent youth homelessness. What is HHS doing to address and prevent youth homelessness?
Senator, thanks for that work that you're doing. We are working with states. I'm the chair of our Interagency Council on Homelessness, working with HUD and other agencies to make sure that we're tackling homelessness with the support of the local governments who actually have the day-to-day responsibility for it. I will tell you this, we are focused on getting families and children first and foremost off the streets. We're trying to make sure foster kids don't fall into homelessness once they age out of the foster care system. And so we're doing what we can. And by the way, we're also focusing on LGBTQ young people, because we know so many of them end up becoming homeless. And if we get to them early, we can keep them with a family, we can keep them healthy.
Thank you. Thank you very much. Thank you, Madam Chairman.